Hi, welcome to the Starwood Pharmacy Patient Education Series. My name is Tamra Srianant, and I'm a physician assistant working at North Texas Diabetes Endocrinology in Flower Mound, Texas with Dr. Wasim Haque. Today we're going to be discussing what is diabetes mellitus. We're going to hopefully, at the end of this discussion, be able to describe what is glucose, where does it come from, and define what is prediabetes versus diabetes, and the difference between type 1 and type 2 diabetes, and finally, the complications of diabetes. Before we begin, we're going to talk about glucose and where it comes from. Glucose comes from carbohydrates, which is a food group that we eat. This is associated with foods such as breads, rice, pasta, noodles, tortillas, a lot of the foods you really enjoy eating. When you eat starchy foods, the salivary glands in your mouth secrete an enzyme known as amylase that begins the digestive process. Food is then moved from your mouth into your esophagus and then into the stomach, where it eventually ends up in the duodenum, a portion of your intestines. In the duodenum, amylase, a hormone from the pancreas, breaks it down into smaller units where it is absorbed further down in the intestine. So how does glucose get into the cell? The cell receptor on the outside of the cell is bound by insulin, which thereby opens the gates and allows the glucose to then enter the cell. Glucose in the cell can be used for energy. Imagine eating a bag of chips and then having to work on a crossword puzzle. Your brain utilizes the glucose at the brain tissue level to thereby be used as energy so that you can concentrate on the crossword you're doing. When the body does not need to use the glucose as energy, it stores it as glycogen. It is stored in the liver and in the muscles. So imagine you're about to exercise. The body can utilize the glucose that's stored in the muscles for energy so that you can run or exercise however you want. It's also stored in the adipose tissue as fat. Now we're going to differentiate between type 1 and type 2 diabetes. In type 1 diabetes, the pancreas does not produce insulin at all. What that means is that the glucose remains in the bloodstream and cannot be utilized or stored properly in the cells. These patients are typically thinner patients. They're also usually to present very early on. In some cases, they can present later on in a condition known as latent autoimmune diabetes. This condition usually has an acute onset in something known as diabetic ketoacidosis, or DKA. This is an absolute insulin deficiency, and patients to be treated properly typically require insulin, whether injectable or inhaled insulin, which we'll go over in more detail in a later discussion. Type 2 diabetes, the pancreas produces insulin, but the cells do not respond appropriately. This is known as insulin resistance. The pancreas tries to overcompensate for the lack of response by overproducing insulin, and this condition can be associated with other things such as high blood pressure, high cholesterol, obesity, and other cardiovascular conditions such as heart attacks and strokes. These patients are typically obese and overweight, and there tends to be a genetic component associated with this. The prodrome period, or prediabetes, is typically asymptomatic, and there's a gradual onset. In this slide, we can see the difference between the timeline associated with prediabetes and diabetes. In prediabetes, the prodrome period, the pancreas is working hard. It's overproducing insulin, and the insulin resistance continues to increase. Over time, the beta cells, which are the cells of the pancreas, become worn out and tired. By the time of diagnosis of type 2 diabetes, the pancreas beta cell function loss of functionality is about 50%. Over time, the way this manifests is when you check your blood sugar, either pre-meal or post-meal, the numbers start to go up. It's very important that we appropriately treat patients who have prediabetes to prevent progression to diabetes. And when you have diabetes, it's important to know where you're at, what stage of diagnosis you're at, whether you've had diabetes for 5, 10, or 15 years, because the treatments will vary. Let's define what is diabetes and prediabetes. Prediabetes is defined as a fasting blood glucose higher than 100, but less than 126. A1C, which is a 3-month average of your blood sugar, is defined as an A1C between 5.7 and 6.4%. Patients who have diabetes are defined as having an A1C over 6.5% and a fasting glucose that's over 126 on multiple occasions. If you have questions about which diagnosis you have, please speak with your provider. So why is this important and why do we worry about having diabetes? The main concern is not necessarily the numbers, but what it does to your body internally. Generally with diabetes, it is an onset that is very gradual when you have type 2 diabetes, and you may have no symptoms at all. Over time, you can develop complications, which we'll get into a little bit more detailed in a minute. Acute complications for type 1 diabetics is that diabetic ketoacidosis, or DKA, and in type 2 diabetes, it's glucotoxicity, when the pancreas becomes so stressed and so worn out that it stops producing insulin. And for a short time, you may even require insulin until the pancreas resolves. The complications of type 2 diabetes are numerous. The organs that are affected include your eyes. You can develop cataracts or something known as diabetic retinopathy, which can eventually lead to blindness. You can also develop peripheral arterial disease, which is where the arteries in your legs become blocked. Blood does not circulate the way that it should, and you can even have symptoms such as cramping in your legs. You can also have loss of kidney function, and this can eventually progress to the need for dialysis. Of course, everyone knows you can also develop cardiovascular side effects, such as heart attacks and strokes, and also loss of limb if you lose feeling from diabetic peripheral neuropathy. We do stress the importance of appropriately treating diabetes, and I hope that this talk has helped you understand a little bit more about your diagnosis and empowers you to be able to take hold of what your diagnosis means for you as a patient so that you can appropriately treat your diabetes and prevent these complications. Thank you.
Thank you for joining us today and watching our videos. And if you have any questions, please give us a call at 214-618-0052 at Starwood Pharmacy, or you can go online at starwoodpharmacy.com. Thank you. Have a great day.